Okay. Andy, are you there?
Yes.
Okay, if you wouldn't mind letting them in now.
Okay.
Good afternoon, everyone. My name is Diana Bando, and I am the Associate Director of Communications. Welcome. Thank you so much for taking time out of your busy day to spend some time with us, exploring the intersection of reproductive justice and housing. This conversation will include our Community Engagement Director, Tamela Milan-Alexander. And, just a quick housekeeping note that, to make sure that put yourself on mute. And lastly, we are also recording this webinar. So we're going to go ahead and get started because I know it's 1 o'clock. So again, I'm Diana Pando, and I'm the Associate Director of Communications at EverThrive, Illinois. And you have signed up for Exploring the Intersection of Reproductive Justice and Housing. And bear with me for one moment. I'm trying to share. Andy, can you move to the next screen if possible? Or let me see. Oh, here we go. Never mind. Tech issue resolved. As we know, having and raising a healthy family is a human right, but not all families have the same opportunities and access to resources to thrive. EverThrive Illinois believes in reproductive justice because everyone should have control over their bodies and access to the resources they need. For those of you that are not familiar with the work of EverThrive Illinois, our mission, EverThrive Illinois' mission, is to achieve reproductive justice in the healthcare ecosystem through community-driven partnerships, policy action, and systems change. Our vision includes an affirming healthcare ecosystem where individuals, families, and communities can thrive. Our values include reproductive justice, anti-racism, centering the most impacted, bold action and transformation. Our strategic priorities include achieving birth equity, expanding access to comprehensive health care, creating safe and sustainable communities, and uniting with partners to advance reproductive justice. So what is our reproductive justice webinar campaign? So we created this campaign to provide a space to educate and learn about reproductive justice and the intersecting issues that impact people, choice, and the choices to raise and sustain a healthy family. For our webinars, we want to explore specific human rights issues and how they impact reproductive health and autonomy. Today, we're discussing how housing insecurity is a reproductive justice issue. So we wanted to take a moment to define homelessness and housing insecurity. So the way that homelessness or houselessness is defined is the state of not having a home. Housing insecurity, on the other hand, is not having stable or secure housing arrangements due to risk of eviction or safety concerns. So, homelessness and housing insecurity in Illinois by the numbers. In 2023, it is estimated that 11,947 Illinoisans experienced homelessness on any given night of the year. Out of that number, 4,045 are people in families with children. In 2020, we saw a little over 50,000 people receive homeless services, including emergency and transitional housing, supportive housing, and homeless prevention services. In the 2022-23 school year, over 58,000 students also experienced homelessness in Illinois, which was a 22% increase from the 2021-22 school year. In 2020, 4% of recent Illinois mothers reported experiencing homelessness 12 months before they had their babies. Let's see, bear with me. Other data showed that there were a little over 100,000, 109,000 people who were experiencing double up homelessness. So what double up homelessness means is that they're temporarily staying with someone else due to hardship. Hundreds of thousands of people in Illinois are at risk of being evicted due to renters' costs. Also, the lack of family-based housing in Illinois is also an issue, and I think Tamela will be covering a little bit of that as well. And so the question is, who is the highest risk for homelessness and housing insecurity in Illinois? So that the highest risk are Black Illinoisans, people with children and families, pregnant people, low-income earners, people with disability, LGBTQIA youth, domestic violence victims, and people with mental health crises and substance abuse disorders. So now I'm going to turn it over to my colleague, Tamela Milan-Alexander. She's the Community Engagement Director for Ever Thrive, Illinois. And I'm going to go ahead and get us started. Hi, Tamela. How are you?
Hi, Deanna. How are you? Thank you for having me today.
Oh, absolutely. So, Tamela, we wanted to start off with our first question. How is housing a reproductive justice issue, and what is the impact of reproductive health outcomes on birthing people?
Well, again, Deanna and our guests in the room today, everyone deserves the opportunity to make informed choices, right? And be able to do that around their reproductive health in safe and supportive environments, of course. But it's also a part of those social determinants of health that's really overlooked when it comes to safe and stable housing. And again, we feel that that's a fundamental right and a critical determinant of reproductive health and autonomy.
Thanks, Tamela. We appreciate you giving us some insight on this. Tamela, can you tell us, how is Ever Thrive Illinois engaging in efforts to address the homelessness crisis?
So as you know, or don't know, we have been at the table with many organizations currently uplifting the fact that especially Black pregnant and parenting individuals are, of course, at a higher risk to be homeless, especially in Illinois, across the state. One of the things that we've attempted to do is work with organizations like I Promote, in which they were really, really helpful in helping craft some of that education, especially around being double up, and also our work with the collaborative on child homelessness with the Illinois chapter for the American Academy of Pediatrics. So I've had the honor to sit in those groups with those individuals, and again, to advocate, especially around the maternal health crisis when it comes to infant and maternal mortality, which we know is impacted and a part of the root cause of infant mortality and maternal mortality in the state of Illinois. And again, it's really about amplifying the resources and the choices for families that are most impacted in Illinois by being a part and being involved in those efforts across Illinois. And we continue to work with different organizations to ensure that we are, again, being a partner a thought partner in our work. And we've also been really, really intentional about those that serve in our family councils, which we have across the state, to be able to also use their voice in this space to talk about navigating, right? Navigating not having stable housing and not having access to housing while pregnant and parenting. So we are really working hard, not just from that top down, but from sort of that bottom up perspective of including voices in our work as well.
Tamela, thank you. I was also gonna lead into, some of the actions that we can take to advocate for equitable housing policies as well.
Absolutely. So one of the things that we have done is not only the work that we've been a part of through coalition and committee work, but we are also a part of a work group for housing insecurity and homelessness in Illinois among pregnant and parenting individuals. And we are developing policy recommendations, of course, as a part of this group. And we're also advocating for the implementation of the new Illinois Behavioral Health Transformation 1115 waiver to use Medicaid funding for housing needs for pregnant and postpartum populations. And we are, again, always advocating for solutions to address social drivers for pregnant and postpartum people, their infants, and of course, the whole family.
Thank you, Tamela. Tamela, did you want to share perhaps like a personal anecdote or story, your own story?
Absolutely. As a young adult myself, I used to live in Henry Horner Homes, a public housing project located on Chicago's West Side with my children. And while living there, of course, I struggled with drug addiction and temporary lost custody of 5 of my 6 children. And I had to fight to get them back. And looking to get back on my feet, I had to stop using drugs and entered a methadone program. And once they started to tear down Henry Horner Homes, I was given a Section 8 voucher and thought that would be really sustainable to look for a suitable place for my kids. But, again, when we think about how folks access different services, I had a job. I thought I would, be able to access a pretty good place. But again, as I continue to grow in my role in the work that I do, working with moms and babies who have issues and problems and just need a hand up and not a handout, of course, it became my life's work because I went through the Section 8 program, because I stayed in housing that wasn't safe. I could talk about how it impacted my life and how, there was always this thumb and this restriction when it came to getting housing, and especially housing when you had such a large amount of children as I did when I was looking to get them returned. And then, of course, I had a son, a young Black male in the city of Chicago, and with his chance of always being arrested, 1 out of 3, my entire family had to always go to like informal hearings because he got arrested. And a lot of this becomes a barrier for some of the families that we're serving, and we hear about, right, how they are, again, being evicted, not being able to afford 3 times the amount of rent. So all of these things I'm aware of because, again, while I had a housing voucher, it was still always a barrier. And so you can only imagine what someone is going through and they don't even have that. And so, again, it's really about not being stuck and how we can change people's lives. And so one of the things I'm just blessed to have been able to do is to buy a home after 21 years on a Section 8 program. And again, for me, working with other families who had to endure what I've had to endure or not had or didn't even have access to a voucher that could support their families, for me, is the biggest passion of my life. Again, I myself have 6 grandchildren, and my children also have struggled with accessing affordable housing. And as you know, the rate for homelessness among Black Black pregnant women and parenting women in Illinois is 6 times the rate as of the population. So again, for me, I take this as a passion. The work that we're doing here at Ever Thrive really is to uplift the voices who have to navigate through these different systems. But also a big part of that, again, is working with different organizations and being able to, again, work side by side to ensure that we're advocating for the policies that impact those folks who are impacted, impact folks who are suffering through not having stable housing. And it's more than just, we talk about folks, couch surfing. If you had to couch surf with in a family and you just had a newborn, and the folks where you stay at, they're smoking in the house, and there's other things, it's not safe. There may be a level of domestic violence going. So there's all these different intersections that impact pregnant and parenting folks. And so again, how do we get folks off those sofas? How do we get people off the streets? How do we leverage some of the resources and the programs that we know can work, and use our voice and our coalition to support the changes that need to take place here in Illinois?
Oh, Tamela, thank you so much for sharing your story and talking to us a little bit about this intersection between reproductive justice and housing insecurity. I wanted to move into our next slide, which is resources. Resources are super important because we want to make sure that everyone has access to different resources around this issue. So we've put together a list. You will get it via email after this call. So we have the Chicago Coalition to End Homelessness, Housing Action Illinois, the Illinois Department of Human Services, Start Early. Also on our website, you'll also find resources, and you can definitely stay connected with us. Our next webinar is going to be on food insecurity and reproductive justice on December 4th. And our featured speaker is our External Affairs Director, Kathy Walagora, who will join us to talk about that particular topic. I did want to mention before we conclude that we are in partnership with Blue Door Neighborhood Center. We will be doing a birth equity conference that is happening on November 7th from 9:30 a.m. to 1 p.m. Again, that's November 7th, and that'll be at the Blue Door Neighborhood Center in Morgan Park. The Birth Equity Conference is free, so hopefully you can join us. I will be sending out a link for registration, and it'll feature advocacy panels also speaking on this topic and other important topics around reproductive justice and birth equity. And they'll also have some community panels as well. We'll be able to hear from the community and learn from them as well. So I'm going to stop sharing the PowerPoint. But again, you will be hearing from me again soon. So I'd like to thank Tamela again for jumping on this discussion. We thank you so much. And everybody who took time out of their day to connect with us and learn a little bit more about reproductive justice and housing insecurity. So again, we'll be in touch again soon, and hopefully we'll meet you in person on November 7th at our half-day birth equity conference. Thank you again. Have a great afternoon. Bye-bye.